This is April Norris, a graduate student at the School of Nursing at Auburn University, and today we'll be talking about medication calculations for pediatric patients. Our objectives: after completing this module, the student will understand the differences in pediatric medication dosage compared to adult dosages, understand and identify the recommended methods for delivery of pediatric medications, correctly calculate the dose of a medication based upon a milligram per kilogram dose, and demonstrate correct programming of a pump to administer a medication over an appropriate time. Before we can begin talking about pediatric dosaging, we need to understand the differences between adults and children. Adults are no longer growing. Their bones are formed. They're no longer having as many changes as children do. The dosages are based upon the average safe dose ranges because they have a more standardized metabolic process that is more standardized among your average adult. They are prescribed on the average doses of an individual who is 12 and a half years or older. On the contrary, children vary in size, composition, surface area, and metabolism. The metabolism and excretion of drugs are dependent on their growth and maturity. They are actively growing every day. Their hormonal shifts, cellular growth, and the bone growth affect how they absorb, excrete, distribute, and the amount of toxicity a medication may have upon them. For example, newborns have a large water distribution within their body, and their livers are immature. So their dosages have to be modified to account for these things. Also, there's alterations in medications that must be made because the chemical changes can alter some of the cells that are growing for life. An example of this is medications that can't be given to children because it may stain their teeth, or it cannot be given IV because of certain changes that will be altered for the rest of their lives. Most medications are prescribed upon a weight in kilogram or a body surface area. It is important to understand and know pediatric dosing because we need to be able to reduce the potential toxicities. There are safe dose ranges, and they can be found in guides as Lexicomp, Micromedex. I believe Hippocrates has some of those, and in your facilities they should have these helps. Most are based upon a milligram per kilogram per day, microgram per kilogram per day, or in the case of some chemos, a body surface area of milligrams per meter squared or micrograms per meter squared. Most are based upon the kilograms. So if you have a child's weight in pounds, it's just divided by 2.2 to become kilograms. And then the body surface area this is the formula for this. You don't need to know this, but it's just your weight in kilograms times your height in centimeters divided by 3,600, and it's the square root of all of that. This is used a lot of times for chemotherapies. An example of that we'll use later is Tylenol safe dose is 10 to 15 mg per kg per dose, and morphine safe dose is 0.1 to 0.2 mg per kg per dose every 2 to 4 hours. So what happens if you don't have one of these guides? Well, there's a couple formulas. I'm not expecting you to know this, but in case you were ever in a rural hospital and need to be able to calculate what the dose might be for a pediatric patient, just know adult dose is based upon a person's 12 and a half years or older, which is 150 months. So that'll kind of help you out with these rules. Freed's rules is for infants that are up to a year old. It is in months divided by 150 times the adult dose, and that will give you an estimated pediatric dose for that age. Young's rules for those that are above 1 year. So you take their age in years and divide it by age in years plus 12, because remember we talked about the 12 and a half years, and multiply that times the adult dose. Clark's is the one that has to do with the weight, but instead of being in kilograms, it's in pounds. So you would take your kilograms and multiply that times 2.2 to get you pounds. So you take the weight in pounds, divide it by 150, and multiply that times the adult dose. So just for general knowledge for y'all. Most children will have medications that will be orally taken. When you have smaller kids, and even some of the older kids, they have trouble sometimes taking tablets and capsules. So a lot of those are in suspension or in liquids. So it's important to understand the difference in the oral syringes versus the IV syringes. IV syringes, as you can see right here, they're clear. Most of them should be Luer lock, and you never ever want to use these kind of syringes for oral medications. You always want to label your medications so that you know that they are IV. Many articles have been written on patients who have died after having a oral medication given to them in an IV. And so you want to make sure that it's connected. Don't be jamming it in there. That's why the Luer locks are made for that. The oral, most of them are orange or have some orange writing on them. The Joint Commission recommends to have syringes that are specifically for oral use to decrease any sort of problem or confusion between oral or IV medications. They're usually amber, they cover up, that will protect them from light. You never ever want to use these for IV medications, and you never ever attach them to an IV line. So think of O for oral, O for orange. And these are just the different ones. It's also important to note that the different sizes have different meanings for each of the little tick marks that are on them. As for a 3 cc syringe, each little mark is going to be a 0.2, 0.4, 0.6, 0.8, 1. Whereas a, say, 12 cc syringe may have the same tick marks. One that is like 35 cc, each one of these is going to be 1. And then likewise in the oral, each one of these, 0.2, 0.4, 0.6, 0.8, 1 milliliter. Whereas in the larger 20 milliliter oral syringe, each tick mark is 1 ml. And so you would pull your plunger back to the appropriate line for the dosage that you need. Pediatric oral medications can be given by the parent. Many times children will take the medication from their parents better than from a nurse. However, it is still the nurse's responsibility to check the medication's safety, dose, and delivery. Once you've checked off those 6 rights, then the parents can administer the medication. And I would warn you never to take medications into a patient's room and just hand them to the parents or lay them on the table and say, here you go, mom, give these, because inevitably you will have that patient that you walk in at 2 p.m. and that 8 a.m. medication is still sitting on the table. So we'll start out with some basic calculations. What dose of Tylenol would be safe for a 4-year-old that weighs 20 kilograms? Well, we know that our safe dose of Tylenol is 10 to 15 milligrams per kilogram. So we simply take these and we multiply it times the kilograms. 10 milligrams times 20 kilograms is 200. 15 milligrams times 20 kilograms is 300. So the safe dose is between 200 and 300 milligrams. So a doctor orders 400 milligrams Tylenol every 4 hours for a 5-year-old who weighs 30 kilograms. Is this a safe dose? Well, let's find out. 10 times 30 is 300. 15 times 30 is 450. Our dose is 400, so yes, it is a safe dose. When you prepare medications, we've got that Tylenol 400 milligram PO. We go into the IV room or to the medication room and we get in the Pyxis and we pull out a cup and it says Tylenol liquid, 160 milligrams per 5 mLs. So I want 400 milligrams. So how much do I pull up? So there's a couple of ways that we can do this. The first way is a ratio problem. You think back to chemistry and how you would do ratios, it's the exact same way. You've got 160 milligrams per 5 mLs. We want 400 milligrams, so how many mils would we pull up? So it's as easy as setting up as a ratio. Remember back in chemistry, to figure out that, you would cross multiply your 400 times your 5 mLs, and then you would divide by your 160 milligrams, which would give your answer in mils, which is 12.5 mils. So just cross multiply, divide by, come back across, and then your answer right there. There's another way, it's called desired over have times amount, or what you want over what you got times your vehicle. So we have 400 milligrams. I'm sorry, we want 400 milligrams, but we've got 160 milligrams, and it's in 5 milliliters. So what you want over what you got in your vehicle. 400 milligrams is what we want, 160 milligrams is what we have in 5 mLs. 400 divided by 160 times 5 mLs is 12.5. And then a final way, you can always figure out how many milligrams are in 1 ml and then figure out how many mils that you would need. So if there's 160 milligrams in 5 mLs, that means each ml has 32 milligrams. We take what we want, we divide it by that milligram. It'll tell us how many milliliters we need. Likewise, we can also do this with IV preparations. Zofran is often given for nausea, and you've been prescribed 3.2 milligrams every 6 hours. When you go into the med room in the Pyxis, you pull out the vial that's 4 milligrams per 2 ml vial. Well, we can set up our ratio. 4 milligrams equals 2 mLs. 3.2 milligrams equals how many mLs? 3.2 times 2 divided by 4. It's going to give us 1.6 mils. Over with our desired over what we have times our vehicle, 33.2 milligrams is what we want. 4 milligrams is what we've got. It's in 2 mils, 1.6 milliliters. And then if we've got 4 milligrams per 2 mLs, that means that every mil has 2 milligrams in it. We want 3.2 milligrams. There's 2 milligrams per mil, 1.6 milliliters. It's also important for you to understand that medications are filtered or broken down by different organs and systems. The kidneys are the main filtering system that clear medications. So medications that are nephrotoxic, gentamicin, for example, can cause injury to the kidneys, especially in children. So a lot of times these medications will be diluted in a certain amount of fluid to help flush the medication through and protect them from reactions or toxicities. Basically, I want you to know that there are minimum concentrations and recommended concentrations for children that hospitals have. In pediatric hospitals, though, they're usually already diluted. So I just want you to be aware in case you are in a rural hospital someday and have to make your own concentration, that there are minimum and recommended concentrations for certain medications. So let's talk about our rate of administration. It is recommended for pumps to be used for pediatric administration of medications. They are set at an ml per hour or a rate time. It's important that you know the dose and volume of your medication and the patient's weight. Many infusion pumps, they'll calculate the safe rate for you, but you have to know your milligrams of your medicine. You got to know how much volume they're in, and then you also have to know how much your patient weighs. So to calculate the rate of administration, because you don't want to just take your pump's word for it, you're simply going to take the total volume that your medication's in, you're going to divide it by the number of minutes that the infusion should run over, and then since you're doing it per hour, you're going to multiply it times 60 minutes because there's 60 minutes in an hour. So let's do one. Cefepime, 400 milligrams is in 40 milliliters and it's to run over 30 minutes. You just take your 40 mils, divide it by 30 minutes, and then you multiply that times 60 minutes in an hour, you get a rate of 80 mils per hour. And if you look at it, 80 is twice the amount of 40, and we're giving the medication in half of an hour. So you would have to run it at twice a rate. So that's kind of one of those that you can kind of check yourself back on there. So micafungin, which is an antifungal that's given a lot of times in HEMOC and BMT, it's 450 milligrams has been ordered in 45 mils, and micafungin runs over 90 minutes. So even though this is longer than an hour, you're just going to do your 45 mils divided by 90 minutes. That's going to give you 0.5. 0.5 times 60 minutes an hour, you're going to run it at a rate of 30 mils per hour. And if you think about it, that first hour, you're going to have 30 go in. The next hour, in just half of it, you're going to get 15, which is the 45 milliliters. So it is recommended that an infusion pump be used for administration of medication to pediatric patients. So before you do anything with the pump, you want to make sure that you have the correct patient, medication, the dose, the safe dose, the volume, and then the ordered time of administration. To set up your pump, you're going to turn it on and then enter the medication or choose the correct medication's name. Enter the dose. Make sure that you know how it's supposed to be programmed. Is it a milligram per kilogram per day, or is it a milligram of the med? You would enter the volume, so the total amount of fluid that the medication is in. How much fluid is in that bag or in that syringe? Then you would enter the time to infuse over, and then start the medication. Make sure that afterwards you check. I always run my hands all the way down from the syringe or the bag to the pump, under the pump to the patient to make sure that everything is unclamped. And then if it is a piggyback medication, be sure to watch it drip from that chamber 3 times at least, not once or twice, but make sure that you see 3 drips. There is nothing worse than coming back an hour and a half after starting a medication, thinking that you're about to take it down and the bag's still full. So always make sure that you see those drips from the chamber. So here is what the screens on a medication pump usually look like. In this instance, we've chosen diphenhydramine or Benadryl. We would enter the drug amount in milligrams, the volume, so 3 mils, and then the patient's weight. That would give us, it would automatically calculate the milligram per kilogram. And then we would hit next. It would take us to the next window where it's going to say, how much do you want to infuse? Well, we want to do it all because it is in 3 milliliters. It already has programmed in there. It already knows that Benadryl should go over 10 minutes. And so it already has put the rate at 17.7, which is 1.25 milligrams per kilogram, and then a concentration of 6.25 milligrams per milliliter. If for some reason we needed Benadryl to go a little bit longer, you could always change the duration and it would automatically change the rate. And then of course you would just hit that start button. So let's practice. KW presents to the pediatric clinic with a fever for several days. Doctors ordered Motrin, 25 milligrams PO 1 time, and Rocephin, 2 grams IV over 30 minutes. She is a 6-year-old and weighs 25 kilograms, but her mom says she cannot take pills. She only can take the liquid medications. So let's go ahead and tear this apart medication by medication. So the first one is Motrin. It is in the Pyxis and it's available in 100 milligrams per 5 ml liquid. And we know that the safe dose of Motrin is 5 to 10 milligrams per kilogram every 6 to 8 hours. So starting with that, we're going to take 5 to 10 milligrams per kilogram. She weighs 25 kilograms. So 5 times 25 is 125. 10 times 25 is 250. Wait a minute there. So what was our dose? It was Motrin 325. So what are we going to do? We're going to call that doctor and say, hey, you ordered this for 325 milligrams, but safe dose is 125 to 250 milligrams. And when you do that, the doctor thanks you so much for saving him and the patient and said, oh, I made an error in that and meant to write 235 milligrams. Thanks for catching that. So going on our next our next dose would be the 235 milligrams, which was supposed to be written. And that is between the 125 and 250. So we have made sure that we have a safe dose. And in the Pyxis, it's available, as we said, 100 milligrams to 5 milliliters of liquid suspension. So exactly how much are we going to give? Well, we can use that ratio method. 100 milligrams equals 5 mils. So 235 milligrams is going to equal how many mils? Well, cross multiply 235 times 5 divided by 100. It's going to give you 11.75 milliliters. For those who like the desired over have, we put our desired or what we want over what we have or what we've got, 100. And then we're going to multiply that times our vehicle or how much it's in, 5 milliliters, 11.75 mils. Or those who just need to do it by mils. There's 100 milliliters and 100 milligrams per 5 milliliters. That means that each milliliter has 20 milligrams. Take 235, our dose, divided by 20 milligrams. It'll tell you you need 11.75 milliliters. So we grab our nice little oral syringe and we pull up our 11.75 milliliters. And if you'll look right here, you can't really see it because there's not a 0.75. So you'll take 11, 0.2, 0.4, 0.6, and right in there between that 0.6 and 0.8, it's going to be 0.75. And then we're going to take that in and let KW's mama and give it to her. Well, we also have Rocephin. We're supposed to administer 2,000 milligrams or 2 grams, and it goes over 30 minutes. So the Rocephin dosing is 50 to 100 milligrams per kilogram per day IV. It's going to be over 30 minutes. There should be a max dose of 4 grams, so we're underneath of that. And then the max concentration should be 10 to 40 milligrams per milliliter. So our safe dose, we take the 50 to 100 times 25 kilograms, because that's what kg is. So we've got 1250 to 2500. That 2,000 milligrams is certainly within that. So we are safe. We are going to look at our concentration. So you would do a milligrams per mil. So 2,000 milligrams divided by a 10 milligram concentration would give us 200 mils, or 2,000 milligrams divided by 40 milligrams, which is our max concentration, would give us a 50 mils. This facility actually has the Rocephin in a 50 milliliter syringe and sends it up. It's supposed to be over 30 minutes. So we are going to give 50 milliliters divided by 30 minutes, and then we're going to multiply that times 60 minutes in an hour. So our rate is going to be 100 milliliters an hour. So our medication is Rocephin or ceftriaxone. Our dose is 2,000 milligrams. Our volume, it's in 50 mils. Our time is going to be our 30 minutes, and our rate would be 100 milliliters per hour. And then, so we're just going to enter it right over here, 2,000 milligrams, and our volume, 50 milliliters. Our patient's weight, we know, is 25 kilogram, which gives us that dose that's automatically calculated at 80 milligrams per kilogram, which is within our safe dosing. And so the next screen is going to say volume to be infused, all, and it's going to go over 30 minutes. So it's going to run, and this syringe maybe was just a little underfilled. So it's going to run at that rate of 98.5, but it's all going to be in there. We're still at the dose of 80 milligrams per kilogram with a max concentration of 40 milligrams per mil. And then we're going to hit start, and we're going to run our hands down the line and make sure that nothing is clamped. So now it's your turn. I have included a dosage jeopardy so that you can check your calculations on several patients' medications. I recommend that you start at the top of a row, so don't just like pick, the 4th row for 400. Go ahead and start at the top and work your way down, because they kind of build upon each other within the patient category. And then after you feel pretty good with all of that, there is a graded assignment. It's going to be in the assessment file that corresponds with this module. You can answer the questions, and then you're going to shade or color in the appropriate amount of medications that would be needed in the appropriate syringe. So if it's an IV medication, you're going to want to shade in the appropriate amount on the IV syringe. If it's PO, you're going to want to make sure that you do it on the oral syringe. And then on some of the questions, the medication if it's to be administered IV, you're going to enter the correct information to program the pump for the correct time. So what you can do is you can print that assessment file and answer the questions, shade in the appropriate ones, and complete the assignment, and then scan that or take a picture of it to be able to submit it in the appropriate placement on your module. If you have any questions, please don't hesitate to email your instructor. And that concludes this module on pediatric dosaging.